And both victim's father and her sibling had felt that it was unusual for a patient like Kruthika to have a cannula on her leg for getting a drip injection. That also was something which raised suspicion, the unusual placement of the cannula, Dr. Rao.
See, propofol is given IV. So, and it is a milky looking fluid. This is why Michael Jackson used to keep calling it my milky treatment. And this it can't be given by mouth or by a regular intramuscular or a subcutaneous injection. It has to be given IV because it is mixed with lipid which dissolves it. So, what kind of GI problem she had or health issues she had that he can justify using propofol, I don't know, because propofol is used only for anesthesia. And secondly, like I said earlier, you can't be using it at home. These people were not doctors, but that sister is a radiologist, so she may have spoken to her other friends and then realized that what kind of injection was going on, what kind of disease was there that he is trying to treat. So she would have got suspicious. And we also don't know if she has seen, after all, these people are all in the same hospital, were they seeing his behavior in the hospital as to what he was up to?
Yes.
Like Mr. Sahai said, there may be a cause of, there may be a motive that we don't yet know about.
Okay. More breaking news, in fact, now coming in. The victim, Dr. Kruthika, refused to remove the cannula from her leg even if she had excruciating pain, stating her husband wouldn't want it. She refused even after her father and her doctor sister insisted her to remove the cannula from her leg. So this is also something that was unusual. The family had repeatedly urged her to take it off, but her husband did not want her, and which is why the victim did not take off this cannula from her leg belly.
Uday, her kind of illness started on April 21st, starting which her husband, Dr. Mahendra Reddy, was treating her at his house with his father and mother, that is the victim's in-laws. And later on, the next day, he brought her to his in-laws' house, that is the parents of Kruthika Reddy, and there she was at their house in Munekolala when this treatment had been started. Her father still states that there was a cannula that was on my daughter's leg, which he didn't know it because she used to have a kind of a robe on her, so he couldn't actually see it. But her sister had already seen that, and she was taken aback as to why would a person have a cannula on the leg, because usually when they don't get veins on their hands.
Yes, that was highly unusual, of course. More breaking news now coming in. Dr. Nikita Reddy, who is the victim's sister, has said that Kruthika was a healthy person and they believe there were no reasons for a sudden death. Sanjay Sahai, the victim's sister believed that if the victim was perfectly healthy, what explained this sudden death of hers?
I think she being a radiologist, and as Dr. Rao has been speaking about, I think she could see so many red herrings in both the behavior and the nature of treatment, and she would have certainly tried to find out as to what is the nature of medication. Or if I don't try to find out, certainly the doctor who is giving you, who happens to be the husband, would be discussing with at least the radiologist and other people who are aware of this in the medical profession. And the cannula which you are talking about, and the emotional blackmail that you cannot remove this, and Kruthika Reddy was not ready to remove this only because the doctor husband had told her so. So now things are getting tied up, though in hindsight. But certainly the whole thing is getting tied up for how this particular propofol is to be used, in which conditions, in what scenarios, for what purpose, which nature of a medication, whether it will be available, not available, and variety of other things which Dr. Rao has been talking about. Added to that, his behavior, and in a case, he is a doctor himself. And in a case of unnatural death, he is trying his level best that autopsy does not happen, and if the autopsy were to happen, he should also be present at the time of the autopsy. And he would be very aware of the fact that generally people request that autopsy should not be done on emotional sort of an explanation or an alibi. And precisely the same thing this fellow was also trying to do. So my understanding is that Nikita Reddy was able to see through, or at least it has raised enough of suspicion in her that the autopsy was imperative to take